The Movember campaign, observed in November, is dedicated to raising awareness on men's health and the challenges they face. Cancer diagnosis is a life-changing event, which is also very expensive when it comes to treatment options. For more on this topic, let's speak to Dr. Avron Urison, who is the Chief Medical Officer at One Life Insurance. Dr. Avron, a pleasure to have you on the program this afternoon. Firstly, how does the lack of regular screenings contribute to advanced stage cancer diagnosis in men, leading to these increased financial burdens?
Yeah, thanks, and thanks for having me on this afternoon. Look, we know that generally the chronic disease burden in South Africa is significantly increasing, and one of those burdens is actually cancer. It's really significant, and we find both on the female side, so for example breast cancer, and on the male side prostate cancer, those numbers are increasing and the incidence is increasing. And it's probably down to a lack of screening and lack of education about what one should do in terms of trying to find out, one has cancer and early detection. Now, in terms of this, it's really important actually to prepare financially for a burden of cancer or if some chronic disease happens. And what we found, which is a really scary statistic, that on a One Life survey, we found that almost 60% of men who have chronic disease or illnesses don't have any dread disease cover, which means that if these men actually get any chronic disease, be it your diabetes, cardiovascular, hypertension, or in fact cancer, then they're not going to be covered financially. And the burdens can be really significant. Burdens we're talking about are obviously for the cost of medical treatment itself and the side costs associated with that. But there are many costs, financial burdens, for example, for the dependents, supporting the dependents, mortgages, and all the significant financial issues. And this can place an enormous strain on the individual who's just trying to treat his chronic disease. So it's a really important a type of cover, this dread disease or what we call critical illness. And it's quite worrying that so many South Africans don't have it in place.
Dr. Urison, can you elaborate on the different types of cover options available, especially for men dealing with these dreaded diseases, and how these options address the financial implications you've mentioned?
So the three main types of cancer, insurance cover that one can get, we know that there's life cover, there's disability, and then there's critical illness or dread disease cover. So life cover and disability are actually more well known about. But the real important one to actually have in place is what we call dread disease. And this is taking out a policy when you're young enough, so you don't have any pre-existing conditions. Obviously, the older you get, and if you have a pre-existing condition, it's going to get more difficult to get that cover, or it's going to be excluded from your policy. So at a young age, to put a policy in place while you're still young and fit, to actually get that cover for dread disease or critical illness, and therefore if anything develops as you age in life, you won't be excluded from getting that cover. So often we find that individuals want to take out cover, but they phone in at the age of 40 or 50 years old, and unfortunately they already have these chronic illnesses. And then from the life insurance perspective, these individuals, it needs to be excluded from the potential policy, and they can't get cover in terms of critical illness or dread disease for those illnesses that they currently have. Yeah. So it's really important at a young age to actually do the financial planning and understanding of saying, what do I need in place from a life insurance, disability, and dread disease perspective, and put it into place.
So besides cancer, what are the other common dreaded diseases among men, and what expenses can be covered with the dread disease payout?
So amongst men, we have the really big chronic diseases in South Africa, and they're growing. We know diabetes is really significant in South Africa. TB, hypertension, cardiovascular diseases, and of course we said the cancers. And it's really important that men actually go about, if we just focus on the male side, actually go about screening. You need to obviously speak to your healthcare professionals and actually say, and ask them, what should I be screening on an annual basis? And you need to go for those regular checks, those health checks. It's all about, healthcare is really about prevention. and lifestyle, and putting whatever you need to do and put into place to obviously try and decrease your risk of developing these diseases, as you get on in years. So if I would say the most important thing is actually education. Educate yourself or see where you can get information, right. Speak to your healthcare providers and go for the regular screening.
So how does the prevalence of mental health issues, particularly depression among men with prostate cancer, impact their overall well-being and also their financial stability as well, Doc?
So we know, and I'm really happy you brought up this point, because coming out of COVID, we know mental health is a huge issue, and it's a huge buzzword around the world and in South Africa as well. And we know with disease burdens and cancer burdens, mental health issues have really been affected, and mental illness. And we know that around 15 to 30% of men who actually have chronic illnesses actually have mental disease as well, or illnesses. And that's really significant. And it's not surprising. It's not just from the burden of actually having it's not the disease, just the disease itself. There's also the burden of the disease, which obviously creates these mental health issues, and those also need to be treated. And the issue is, if you don't have any financial help in place to help you treat both the physical symptoms and also any mental or adjunct mental issues, it becomes a very difficult process. Right. And often men go into extreme depression, anxiety, and it becomes really significant.
Could you shed a bit more light on the importance of full disclosure about one's health when taking life cover, and how it also relates to the financial challenges that men face after a cancer diagnosis?
So this is really important, and if I want to spend one of the key take-home messages, and listen, as a chief medical officer, I deal with this all of the time in insurance. If you don't disclose all your issues when you make your application, you are going to get into trouble with that when it comes to claim stage. So the key issue is, and it's really simple, just be honest, clear and upfront for every condition that you have, and make sure that it's documented and written down. And if you're not sure, rather ask. Because if you don't disclose all your conditions, as I said, when it comes to claim stage, a claim can easily be rejected on the basis that an issue was not disclosed. And we've seen many cases of this in the press over the last couple of years. So it's a really important point. The second point building onto that is that once you get your policy and you get it back, you should go through it and just check and just make sure that everything you thought you covered for, you are covered for. Right? So if you think you want cancer and that's what you want covered, make sure that your policy actually covers you for cancer. It's a really important point, and probably one of the most basic fundamental mistakes that are made by individuals when they're applying for policy. You need to declare everything up front.
Dr. Avron, as we wrap up, and also in the context of Movember, why is it so crucial to then raise awareness not only about prostate cancer but also about testicular cancer, mental health like we've mentioned as well, and also suicide prevention?
I think it's really important because often we forget about significant diseases, and also diseases that are affecting males. A lot is often said on the female side, breast cancer, cervical cancer, etc. But we need to know that prostate cancer, 1 in 15 men will develop prostate cancer in some sort through their lifetime. And that is really significant. And testicular cancer as well, it's very prevalent. And as I mentioned, mental wellness is also very significant in men. So through Movember, we actually really just need to raise the red flag and say, listen, men are also affected by these illnesses. We know 60% of those men aren't covered with the adequate insurance cover in dread disease, and really they should be reaching out and speaking to the relevant brokers or insurance companies and find out if they are adequately covered on the one hand, and on the other hand that they need to go for screening. They need to just make sure and visit their healthcare professionals and make sure that they're going through adequate screening processes to detect early disease, and that really helps prevention and will help them and their families in the long term.
Dr. Avron Urison, he is the Chief Medical Officer at One Life Insurance.